living through. Release this prologue to the world that would never be the same again. As the book's subtitle says, we have an eminent panel whose members do not need any introduction actually. Just the names would suffice, I think. We have with us Dr. Soumya Swaminathan, Chief Scientist of the World Health Organization, Dr. Randeep Guleria, Director of New Delhi's AIIMS, All India Institute of Medical Sciences, and of course, Sunita Narayan herself. Because of the busy schedules of our speakers, we would be keeping this interaction short, just about 30-40 minutes. We will begin with Sunita ji and then listen to our expert panelists. In case you have questions and comments, please put them in the Q&A box, and the CSE team would try and answer all of them at a later date. So before I pass on the baton to Sunita ji, let me inform you that you can order a copy of this book from the CSE store, the link to which would be shared in the chat box. So Kanya, can you please share the link in the chat box? So yeah, so can we begin, Sunita ji? Thank you so much. Thank you, everyone.
Thank you so much. And I also want to welcome Richard Mahapatra. Richard is the managing editor of Down to Earth, and actually the man behind the book and man behind Down to Earth, which has put together these stories of our present as we make history. And of course, Vibha Varshney. Vibha Varshney is the person who's written many of the cover stories, and she is our go-to person when it comes to any issues on science and health. So these are the two people who have made all this work possible. So Shuparno, should we have the book cover up and do a quick formal release, and then we can dive into the program.
Right. Yeah. So this is the book, the cover. And we have put the link on the chat box. Yes, ma'am. Please continue.
We will take this as formally released, Dr. Swaminathan, Dr. Guleria. So this is the Pandemic Journal, a prologue to the world that would never be the same again. I really miss the time when you would be in the room and you could hold up the book and we could take a photograph, but we will have to make the best of this. So the formal release is over. Thank you, Shuparno.
Thank you.
And I will now do a quick presentation, and then I will turn to Dr. Swaminathan and to Dr. Guleria. So this journal, the Pandemic Journal, is about our common world and what we must not forget and what we must do to change our future. Let me just make it full screen. It's about down to earth, and that's why Richard and Vibha are so important in this story, because without this, this would not have been possible. Frankly, Dr. Guleria, Dr. Swaminathan, this COVID-19 for journalists, for science and health reporters is perhaps the biggest story of our generation, okay? And this book is about 500 days, more than 100 journalists who are tracking events as they happen. Down to Earth actually started reporting on COVID-19 even before it hit the world. We had our first story in January of 2020 when we heard whispers from Wuhan. But this is about events as they have happened. It's science, the personal tragedies, the virus, the mutations, the economic collapse that we have seen in the world. And I'll just take you through the covers so that you understand what we have done. We started, as I said, the first cover we did was in February of 2020, when we reported on what we were hearing from China. At that time, the story had still not even reached Europe. We were still blissfully unaware of it in even India. By April, we understood what COVID was about, the virus was about. We wrote about COVID-19 in April. It's very unusual for any cover in any magazine to do two consecutive covers on one story. But we found that the story didn't go away. It had become bigger and bigger. And by April, the very next issue, we were talking about how the whole world was under siege. In May, we did a fascinating story. This is 2020, last year, not this year, 2020, when Vibha reported on the pharma industry, and she actually reported on how much of the vaccine capacity we had in the world and how much of it was being unused in the public sector. We then moved to the whole story of zoonotics and looking at how The zoonotics plays such a big role, and the whole dystopian relationship between nature and humans. By June, we did a cover story on testing, and Dr. Guleria knows more than anyone else what he has gone through to ramp up the testing protocols in the country and the infrastructure in the country. We wrote about that. By August 2020, we still wrote that about the mysteries, the many mysteries on the unknown disease outbreaks, not just COVID, but all the mysterious fevers that we were seeing around us. By November, we wrote about the immunity challenges and the war behind, and the whole concept of why immunity becomes so important and what does it take. In November, we wrote about the virus, the story about, can you imagine a magazine making a virus a cover story? But it merited that. Then, of course, we got a break. We all thought it had gone away, and we were all, in a time when we had other cover stories like Manrega and, all climate change, all the other realities came in. But by April, everything had again broken loose, and we were back again in April. And actually, the April story was not even on India. It was on Africa, because at that stage, we were more concerned about what was happening, the complete unknown news from Africa. And by then, the Indian story was also emerging. Of course, by May, it was full blown in our face, and we covered it, we wrote about it, and what were the issues. We continued to do that in June, but we moved the story more towards rural India, because what we found was that what we were not getting enough information was what was happening actually as the virus was first time hitting a part of the country which did not have any health infrastructure. What was the state of it? Very interestingly, we then looked at vaccines and really the vaccine inequity in the world, the huge vaccine divide, racism, call it what you want, and the war, as we call it, between the virus, the variant, and the vaccination. But we looked at the cost of vaccination. We looked at why is it the world not getting their act together to get vaccines in the hands of everybody, the jabs that everybody needs. In August, we did a fascinating story, and I think Dr. Guleria will agree on, how do you go beyond vaccines? What are the antivirals we need? What are the other medicines we need? Because it's not just about vaccination, but really about the other drugs that we need. And of course, we looked at steroids in this case. What had happened because of steroids? Sorry, this cover, we looked at steroids. And we looked at what had happened in India because of steroids and the indiscriminate use of steroids. And this cover story, we have looked at the big mystery of Kerala. Why in Kerala is it all about? And Vibha, who's done this story, essentially, because I've been pushing her to say, why? Why does Kerala, most literate, most well-organized, why does it have this virus? And more or less the sense is it's endemic. And maybe Kerala is the future of what we will see in the rest of India. But just to give you a quick snapshot of what we are. And my 3 quick slides to you in terms of the big lessons we have learned over these last 2 years, 500 days, as Richard calls it. We are as strong as our weakest link. The first big lesson we learn is that we live in an interdependent world, COVID or climate change. They both teach us so clearly why we need to cooperate, why we need to understand that unless the poorest in the world have the jab, the richest in the world will not be safe. Same with climate change, same with COVID. Second lesson we learn is that we need more democracy, not less. We need to have institutions with high level of public trust and credibility. And I say this in front of 2 people who I believe have public trust and credibility. When Dr. Guleria speaks, people listen, people trust. When Dr. Swaminathan speaks, people listen. But we need much more of this. Look at the whole anti-vax campaigns. Look at the whole anti-mask campaigns. Look at the kind of disinformation that is happening. And that is happening because of the fact that public has lost trust in public institutions. We need much stronger public institutions with much greater credibility and independence. And this needs independence. It needs the ability to be able to speak truth to power, because when people know that, yes, people will call out that there is a crisis brewing, they trust the institution. And most importantly, for people like Richard, me, and Vibha, and Shuparno, we know that COVID-19 has taught us we need more information, not less. We need more down to earth. We need more reporters. We need to tell the story as it happens. The third is we need to correct our dystopian relationship with nature. Species are jumping across the nature-human barrier. It is about how we manage our environment, but it is also about how we grow our food. Intensive food cultivation is actually destroying the resilience of the animal breeds. It is adding to the amount of, to their vulnerability, and therefore is also adding to the zoonotic diseases. The other thing that we must not forget over this 500 days, because we as human beings are human after all. We tend to block what we don't want to remember. But there are things we must remember. We must not forget. We must not forget the personal tragedies and pain. I mean, in the second wave in India, I don't think there is anybody I know who was not touched by by personal tragedy. I know of the number of people who lost their loved ones, and I know how we all were desperately looking for that oxygen cylinder, that hospital bed, that's something to save lives. We must not forget this. The haunting memories of the dead must teach us never again. Secondly, we must not forget the personal efforts, sacrifices, the endurance of every doctor. I think about the time that the doctors have gone through, the nurses have gone through over this 500 days. I don't think they would have slept. They have not gone home. They have worked in the worst circumstance. We must always remember this. The municipal workers, the frontline workers, we must remember their effort, their sacrifices. We must not forget the haunting faces of the fleeing informal workers. My doctor who works, in fact, at AIMS, wrote to me a very strong mail saying, Sunita, why are you calling them migrants? They are our country people. How can you call them migrants? And since he has said this to me, I am so reluctant to use the word migrant, because I think he's absolutely right. They are workers. They are informal workers in our country who left our cities because our cities turned their backs on them, whose livelihoods collapsed, whose personal stories of suffering and endurance we must not forget. But simultaneously, we must remember the human empathy, the millions who cooked for others, who took care of strangers, who took care of their neighbors. And we must not forget, as we rebuild, we must fix the inequity in our world, which leads to this disproportionate impact on the poorest. Fix the health system so that it can meet the needs of all. Investment in health is the most critical issue, and investments in the determinants of good health is also a critical issue. We must invest in good water. We must invest in urban planning so that there is sanitation for all. We must invest so that there is no air pollution, because all these are determinants of good health. And this investment in health is critical. And yes, we must fix the system for today and the future. And in that, as we remember the human enterprise and scientific innovation that brought us the vaccines at the super fast pace, we must also remember that we will lose the deadly war against the virus, the variant, if the vaccines do not reach all at affordable rates. So finally, this 500 days, this chronicle, this pandemic journal tells the story of the biggest story of our generation. It is our effort to chronicle our present so that we can change the future. It is a record of history. This is one history that we make every day. And we must learn so that we can change. So thank you very much. This is the overview of our, sorry. This is the overview. And now let me invite Dr. Swaminathan. Dr. Swaminathan, you've had one of the most privileged positions, I think, over these last 500 days. I know when I call it privileged, I know it's also the most difficult positions. You have seen it through, sitting at a time when you can see all countries, you can see what is happening. I mean, when you write your memoirs, and I hope you will, the richness of what you see, I don't think we can ever live through. But I wanted you to share with us how you have seen and some of the big things that you see over these last 500 days.
Thank you, Sunita, and thank you to you and your team for really having documented all of these happenings over the last 500 days and now brought them together as a book. I think it's important, it's critical, in fact, that the experiences are documented, and they should be documented at the time that they are happening, not looking back in hindsight, because you often forget the details of that particular day. In hindsight, one is always wiser, and one can always talk about things, saying we should have done this or done that. But on that first day, when you hear about something, how you react, what you do, is what makes a big difference, really. And I think there are lots of lessons for us. I think you've brought out the main ones. I do think that if we look back at the pandemic, we will see, I think the phrase, it was the best of times, it was the worst of times, will be quite relevant. It does describe the best things have come out. People came together around the world, and as a chief scientist here at the WHO, one has been witness to the amazing sense of dedication, of collaboration, of hard work. Scientists have stayed up day and night as well, yes, to make sure that we've had the vaccines and other tools developed in record speed, using all of the advances, of course, over the years, that investments in science, investments in research and development enabled that. The mRNA platform is being recognized today, and Kathleen Carrico and Drew Weissman are receiving a large number of awards. I'm sure they'll get the Nobel Prize. But 30 years ago, when Kathleen Carrico was working on mRNA, she had no recognition, no support. In fact, she had to give up her job at the University of Pennsylvania because she didn't have a research grant. Nobody believed it would be possible. So I think one of the big lessons is invest in science, invest in research, invest in human workforce and capacity, and build up. And I'm glad that science is on the forefront today of our television channels and our newspapers. And I hope that young people will be inspired to take a career in science, but also that the general public understands science more clearly. And this is where I think the role of journalists has been critical, because of the need to bring credible information to people, because there's an equal volume of misinformation out there. Sunita, you mentioned the conspiracy theories, the rumors, and all of the vaccine that's leading to vaccine hesitancy, leading to loss of trust in institutions and in governments. So this is going to be a challenge for us in the future. There's no doubt about it. And we really need to think from a very multidisciplinary perspective how we are going to deal with this type of anti-science movements. Luckily in India, I think vaccine hesitancy has not been a major problem, and it's amazing to see the progress in vaccination campaign. So I think the best side of the epidemic, of the pandemic, has been that we've leveraged science, we've leveraged technology. Look at the way we're tracking viral variants. We have over 4 million genomes today in the GISAID platform. In real time, we're able to track what the virus is doing. The downsides, of course, have been many. And again, these are where we need to learn lessons for the future. And I think you highlighted some of them. The first one is a better understanding of humans and how we live with nature and the environment. And I think going, the climate change conversation also highlights, they're very interlinked, what the pandemic and climate change. And we will only see more such disasters if we do not address the basic drivers. The second one is the gaps in every country's health systems were exposed, and countries' wealth was no predictor of their response to the pandemic. The wealthiest countries have faced the highest burden of cases and deaths. And that's because of chronic underinvestments in public health, while their tertiary healthcare systems are very strong. So again, as India is investing in the Ayushman Bharat and other initiatives to bring universal health coverage, it's absolutely critical to see that, again, we're strengthening primary healthcare, we're strengthening surveillance data, and we're focusing a lot on workforce and the people out in the community health workers, the ASHAs, on whom we rely so much. We really need to value their work, and also to constantly be building capacity of people on the front lines. Because tertiary healthcare will collapse at some point, as we saw, if primary healthcare doesn't work. And then we need, I think, every country needs to, of course, strengthen their own systems, but also needs to think about the global picture and how do you work with other countries. And this is where the role of WHO comes in. And it was clear that, and it's been come out in many reports now, that WHO does not have the mandate or the resources or the power to actually go in and fix things in countries or go and inspect what's happening. We work through a collaborative approach of member states. And so this pandemic treaty that is going to be discussed over the coming weeks and at the World Health Assembly, Special World Health Assembly in November, must address and must face squarely the issues that arose and why they arose, and what global rules and regulations or framework conventions need to be put in place, like we have the Framework Convention for Tobacco Control that was negotiated. Do we need a framework control for pandemics, a framework convention or a treaty? And that should be really the roadmap for the future. And the last point I'd like, so strengthening of WHO is extremely important, because it's clear that you need a multilateral agency to coordinate efforts in these kind of global episodes, which involves everybody around the world. And the last point is really around having the looking at how does one develop and distribute and have equitable access to the tools and supplies that are needed. And from day one of the pandemic, we saw supply chains breaking down. We saw shortages of masks, of PPE, of oxygen, of ventilators, and then later on of diagnostics, of drugs, and of vaccines. And we continue to see that inequity. So we need a system where there's a new model of research and development, where governments that are investing taxpayer funds, public funds, to develop products will need to ensure that there are clauses in those contracts with companies to assure equitable access, to make sure that the products are affordable, accessible, and available to people around the world. Because this is going to now determine the course of the pandemic. We can imagine what the best case scenario is going to be, that the world decides that, we have 1.5 billion doses of vaccines being produced every month. That's more than enough to vaccinate 40% of the world's population by December, which is what WHO has set as a goal, because that will bring an end to the acute phase of the pandemic. It will bring an end, hopefully, to all of these deaths that we're still seeing, 50,000 deaths a week. For the last year, we've never gone below 50,000 deaths a week. Some region of the world or the other, there's a surge. So it will bring an end to the acute phase of the pandemic. And then beyond that, we can continue to vaccinate the remaining population. If no further variants arise, which are more deadly than Delta, then we settle into an endemic phase where the virus continues to cause respiratory infections like other viruses, but we don't see this complete disruption of our lives. There can also be a worst case scenario where we continue to not have vaccines available to everyone, and new variants continue to emerge. And these variants could be, we cannot predict what mutations they're going to now gather, and if they become resistant to the existing vaccines. Luckily, so far, we've not seen that happen. Then we could be in a continuous cycle where high-income countries will then have vaccines manufactured for those particular variants. It will go again only to selected countries. The rest of the world continues to wait. And I think this is obviously then we are condemned to being in a situation where, of course, then the impact is always on the most vulnerable and the poorest of the poor. In every country of the world, the poor are suffering, and of course, in poor countries, they are suffering much more. It's going to take longer for recovery. There are lots of projections on economic losses. So hopefully, our leaders, the heads of states, will agree on a good way forward. I think we're still looking forward to the G20 meeting that's coming up, and this is really the time to make course corrections. But thank you once again for documenting what has happened, because that will help us to remember. As you said, we have to remember the suffering and the sacrifices. We have to also remember, I've lost a lot of friends myself and colleagues. We all have, as you said. And we must do better in their memory. And we all have to learn and improve the way we did things. Learn from the good, but make sure that we don't repeat the mistakes. And that will be our best tribute, I think. So thank you, Sunita.
Thank you, Dr. Swaminathan. Thank you for all those very, very, very wise words and very, very, very deep understanding of where we stand and where we must go. I will now turn to Dr. Guleria. Dr. Guleria is kind of, I see him as the doctor for India, or doctor of India, you know, and he's also somebody we go to, I have to say, any crisis we have, and he's amazing. So, and I know what he's gone through in these past 500 days. So Dr. Guleria, the floor is yours.
Thank you very much, and good afternoon and good morning to everybody. It's great to see you, Sunita, and Dr. Soumya also. And I hope you're all staying safe and are in the best of health. Let me start by really congratulating Sunita Narayan for this book, which has actually documented a lot of things from across the world by 100 journalists, and have really looked at this biggest humanitarian crisis from different angles. And we have focused a lot on the health crisis, but the crisis is bigger than just the health part. And from the institute or the hospital point of view, I can say that it was the biggest challenge that we ever faced. None of us were ready for it. People like us have been talking of a pandemic for maybe almost 20 years, since we had an outbreak of H5N1 way back in 1997. I remember even having multiple meetings in CDC, where they kept saying that the next pandemic will happen in Asia and we must be prepared for it. But obviously, it's when it happens, you really realize the magnitude of the problem that you really go through. And the challenges that we had were tremendous. I mean, I've had meetings every day in the morning in the hospital with the entire staff, the residents, the faculty, the Karamchari Union, and everyone. And every day there is a new challenge that we've been facing. We have the initial challenges of the fear, the stigma that was there with COVID-19, the subsequent challenges of shortage of N95 and PPEs. We did a project of trying to see how we could recycle N95 and PPE, and we were able to do it successfully. And then, of course, how do we really convert infrastructure into a ward where our own facilities are not that good in infection control? We really need to see how do we develop areas where you have good control in terms of ventilation, in terms of central air conditioning. How do you prevent infection from one area to the other, or converting space when you already have shortage of space in the public sector? And then, of course, the huge challenges during the second wave, which happened because of challenges of oxygen. I can't tell you how many nights I've stayed awake tracking the tankers from Panipat all the way down, and how many times I've had to ring up people in the middle of the night because for some crazy reason, some police wala stopped the tanker on the road, and that led us to have oxygen only for about a panic situation. And then having to send our security staff all the way to Panipat to escort the tankers. I used to tell my staff that I think the tanker driver is going to find this a very unique situation, that he has an escort taking him all the way on to the hospital. I think never before have tankers been given so much importance. It was a challenging situation where we had to find solutions every day in terms of whether it be maintaining the morale of our people, creating infrastructure out of nowhere, and then making sure that healthcare workers were taken care of and protected. During the second wave, we had to convert one whole building just for the healthcare workers and their family, because it would be really important for their morale that there is someone to look after them if they become sick, rather than they're not having a bed for themselves. So private wards are converted into general wards, and we started using private wards for all the staff, even if they had to share a room or even if they were not entitled to it. But beyond health, I think it's also important, and that's why I think this book is very, very important, because beyond health, the pandemic affected everyone, from not only the healthcare workers, but to the ordinary rickshawala, to the office blue-collar workers who are going to office, or the people in rural India. Everyone got affected, including children. I don't think there's anyone who was not touched by the pandemic. It affected livelihoods. It caused social and humanitarian needs, which were unprecedented. It actually caused issues of governance and security, if I put it that way. And of course, the economy was hit in a big way. Trade was affected. Laborers were affected, and they had to walk miles to go back to their homes and villages, because there was no job for them in urban India. And one thing that we've really not addressed, and I think is something very important, is the issue of mental health. The amount of mental health it's caused, trauma that's caused, anguish it's caused, not only to those who've lost near and dear ones, but to those who've had to live through issues of lockdown, stay inside the homes, the children who've gone through all of this. And therefore, these are issues that we really need to address. And the book tries to really get all of this together from different angles. So I think it's not only a health crisis, it's an educational crisis, it's a nutritional crisis, it's a crisis at various factors which we need to address. The challenge, of course, is, and of course, the other point that we also forget is the effect the pandemic had on non-COVID care, on the immunization program, on simple things like institutional deliveries. The data shows that this had really dramatically been affected. The TB program suffered a lot. I mean, people who were getting drugs, who were coming forward for the regular DOTS treatment. So these are things which we have never really accounted for. But if we really start looking at this, the effect of the pandemic was humongous. If we now look at the way forward, the sad part is, and this is the worry that I have, is that despite the fact that we've suffered so much, we tend to have a short memory, and we tend to forget, and it becomes business as usual. The pandemic has shown us the importance of things like climate change, things like urbanization, and that's why we have viruses jumping species and causing more and more human cases. And if you look at what's happened in the last 20 years, there have been a huge increase in the number of viruses jumping species, whether we talk of H5N1, H1N1, MERS, SARS. All of them are viruses which have jumped species. So urbanization, trade, travel, and connectivity all are driving the chances of further and future pandemics, and we need to keep that in mind. Therefore, we have to look at the concept of One Health in a total manner, so that we don't forget this. And we must have more data, which is not only from our country but across the world. Somehow, even during the pandemic, that was not available, and data was either not reliable, or it was lying in different silos, and there was no connect between the data, which could have helped policymakers, which could have helped a lot of us in looking at how we can further plan things and be aware of what is going to happen. Very often, because the data was not there, we were actually behind the virus rather than being ahead of the virus. The signals were there, but it was never collated in a manner that could give us warning that we are seeing a huge surge in the number of cases. So I think we need to really work on investing more in the public sector. That has to be done. And I hope that the lessons that we've learned from this pandemic focus on that. And there has to, of course, be accountability as we invest. And we must look at how can we really invest in a manner that we get more out of less, and it's sustainable. If you're able to do that, and if you're able to look at the whole picture, not only from the health crisis, but the crisis in various other sectors, and develop sustainable solutions, then maybe we would have gained something from this pandemic. But I think there is a lot that we need to do. And I really hope that we don't forget the pandemic in the coming years and move on, and it becomes business as usual. Thank you very much. And I wish you all the best. Thank you.
Thank you, Dr. Guleria, and thank you, Dr. Swaminathan. We have an amazing lot of questions, but I think a lot of the questions are also the type which we cannot answer in a webinar like this. We need a sort of a webinar where Dr. Guleria does, which he does regularly. And I think Dr. Guleria and Dr. Swaminathan, there's a lot of appreciation for both of you in the words there for the fact that you have helped to steer us through this crisis. But from the questions, what I'm also seeing again is still people have so many questions, so many doubts, so many fears, so much concern about what the future holds. And I think that's why our conversation today is important. It's important to record what happened. And I'm glad we're all together to see that we are together. And as Dr. Guleria has said, and as Dr. Swaminathan has said, we do not want business as usual. We want business unusual. We want to move ahead differently so that the fears, the concerns that you have all expressed in the chat box, we can actually make sure that we don't have the crisis again. So thank you again, everyone. I am not going to open it up for questions. We are short of time. And we have two guests who are extraordinarily busy, who we have dragged out of, whether surgeries in Dr. Guleria's case or very important meetings in Dr. Swaminathan's case to be with us. And we're very grateful that they came. So thank you so much. And we look forward to having this conversation and continued engagement with you. And thank you, Richard. Thank you, Vibha. And thank you, Shuparno. Thank you very much, everyone. Thank you.
Thank you.
Thanks, Sunita. Keep up the good work at CSE.